Hello, we're going to be giving a subcutaneous medication today, morphine. So first things first, I'm going to gather my supplies that I'm going to need. So we've got a sub-Q needle here, 25 gauge, 5/8. I've got a blunt filter needle, and I've got a 1 cc syringe. I checked the expiry and none of that stuff's expired. So we're going to check the MAR and see what we need. So we can see here that morphine, 2.5 milligrams, sub-Q, Q3 hours, PRN for pain. So what we're going to do is we're going to take the medication out of the drawer. So go to our narcotics container, and we're going to complete our first check. So this is morphine, expiry 12/20/30. And we're going to have to do some medication here, or medication math, because 2.5 milligrams is ordered and it comes in 10 milligrams per milliliter. So we're going to do that math right now. So we're going to have our desired dose, 2.5 milligrams, over our have on hand, 10 milligrams, times it by 1 milliliter, which is what it's supplied in. So 2.5 divided by 10 is 0.25 times that by 1 gives us 0.25 milliliters to give. So because I'm a student, I'm going to get my instructor or my designated registered nurse to check my med math before I give the medication. So now we're going to do our second one, which is drawing up the medication. Before that, we'll just go over our 7 rights. So this is morphine. It's not expired 12/20/30. Right patient, we've got Mr. Harry Wilson here, who I'm going to be giving it to, and I'm going to confirm that at the bedside with the MAR. We got the right drug, it's morphine. The right dose is 2.5 milligrams. We're going to draw that up, which will be 0.25 milliliters. Route, we're going to be giving it subcutaneous, so I've got the subcutaneous needle. Time, it's a PRN medication, but we're going to be giving it at 10:30. Reason, it's for pain. I've done a pain assessment on Mr. Wilson. He's in pain, and morphine is an opioid analgesic, and I'm going to provide the right documentation, dotting and signing my MAR. So let's go ahead and prepare the medication. So I'm going to do some hand sanitizer here. I'm going to get an alcohol swab. Just going to clean the area where we're going to take from. The medication is up in the vial, so we'll flick that down. We're going to get our blunt fill ready. Crack away the sharps. Then we're going to draw 0.25 milliliters. .25. So we get rid of these air bubbles. Perfect, and we've got 0.25 of the medication. Now we're going to fill out our medication label. We're just going to switch to the injection needle here first. Making sure not to touch the ends. We've got our injection needle here, and we're going to fill out our medication label. So we're just working our way through. So we've got Wilson Harry. Room, he is in room 302. Drug, this is morphine. Amount, 2.5 milligrams. Added by, I'm going to put my initials, BK, NICBSN on there. today's date, November 3rd. Time, we're going to go 10:30. Expiry, we know that it's 12/20/30. There we go. And we're going to fix our medication label onto our medication. So that's all ready to go there. We've got that prepped. I'm just going to clear my workspace off some garbage. Okay, and now we're ready for our final check here. So that's returning the medication to the drawer or discarding. So we're going to waste this, and we're going to make sure that we have somebody else to see that we are wasting the narcotic into the sharps. So before we do that, we're going to check expiry 12/20/30. Morphine, perfect. We can discard that right there. Okay, we've got our medication. We've completed our 3 checks. We're good to take our MAR medication to the bedside. So we're going to introduce ourselves. Hello, Mr. Wilson. My name's Ben. I'm a nursing student. I'm going to be giving you a subcutaneous injection here, and it's morphine for your pain. So we talked about that you'd be getting some analgesic today, but what I need to do is just a couple of checks before we give it to you. Okay?
Okay.
Awesome. So I'm going to bring the bed up to a safe working height. Bring my supplies to the bedside. So you're still in a lot of pain. I'm going to assess that pain after I've given you the medication. First things first, we're going to check that make sure it's you. Okay, so we're going to go to your wristband here. Take the MAR right to it. And we see the name matches up, as well as the date of birth and the PHN all match up. And then I can also ask Mr. Wilson, could you confirm your date of birth?
Yeah, September 22nd, 46.
Awesome, great. And I'm just going to check your allergy band here, make sure that it's not the drug that we're talking about. And you don't have any allergies to morphine?
No, it's fine for me.
Awesome. Okay, so we're going to assess our site here. I see that you have some subcutaneous fat on your abdomen, so that will be perfect for us. So first things first, I'm just going to perform hand hygiene. And I'm just going to palpate the area to make sure that there's no obvious masses or discomfort when I palpate.
Nope.
Perfect. Okay, so for landmarking, what I'm going to do is basically create a triangle on your abdomen here from your 2 iliac crests to your sort of just about your umbilicus region here. And in that area, I'm going to come down to the lower end, and we want to go about 2 inches away from your umbilicus. So that puts us right about here. So what I'm going to do, perform hand hygiene again. I'm going to don my clean gloves at the bedside here. And we're going to clean the area with an alcohol swab. We're going to do it for 30 seconds. So we've done that now for 30 seconds. We're going to let that dry. I'm going to prep all my supplies that I'm going to need. That'll be the sterile gauze to apply pressure should there be any bleeding afterwards and encourage clotting. Put that right here. Okay. So we've done all our checks. We've done our 7 rights. I'm going to go ahead and give this medication to you. Okay, Mr. Wilson?
Okay.
Perfect. So what I'm going to do is take the safety hub away. I'm going to pull the area taut around the skin. I'm going to use my dominant hand to insert quickly. Then I'm going to take my non-dominant hand, stabilize, and I'm going to inject the medication at a rate of 1 milliliter over 10 seconds. So we're going to inject this medication here at that correct rate. Perfect. I'm going to remove quickly and cap the needle, and then we're just going to apply pressure with the gauze to stop any bleeding. So, Mr. Wilson, I'm going to return your bed back to a perfect, no bleeding. I'm going to return your bed back to a safe height. I've got my sharp here. And then I'm going to do a reassessment with you in a couple minutes here to check on how everything's going. Okay, do you have any questions for me?
Nope.
Awesome. So what I've got to do after I return the bed to a safe height is dispose of my sharp. So sharp's going to go in the sharp container and garbage can go in the garbage. Alrighty. Oh, obviously you have to do some documentation for that. So we've given on our MAR here, so I've just given the medication. We're going to do 2.5 milligrams. We've given subcut in the left upper abdomen, and I'm going to put my initial on here, so it's BK NIC BSN. Alrighty, I think that's good.